In a Car with IPR is a new series by the Institute for Public Relations where we talk to industry leaders to find out what makes them tick, discuss research, and ask them to look into their crystal ball to see what's in store for us.
Okay, so thanks for joining us for the next episode of In a Car with IPR. Today we're joined with Eileen Sheil, who's the Executive Director of Corporate Communications at the Cleveland Clinic. So we are in Cleveland and it's actually not too cold for December, which is really nice. Thanks for changing the weather for us.
Welcome, glad to have you here.
So we're in the mobile stroke unit. And why don't you tell us a little bit about this?
Sure. We started this mobile stroke unit in 2014, realizing that every 40 seconds, someone in the United States has a stroke. And the key to stroke treatment is really getting the right treatment to the patient as quickly as possible. So we decided to partner with the Cleveland EMS team. And whenever a call comes into 911 where a patient is showing signs of a stroke, they dispatch the mobile stroke unit directly to the patient's house. So we're able to determine what kind of medication they need to get it to them faster and then really make sure that they get to the right hospital for care. And that can be the difference between being able to walk again or being debilitated forever sometimes. So
This is really neat unit. With the,
So it's equipped with a scanner so they can really assess the patient in real time.
Okay, great. And so you've been at Cleveland Clinic for 16 years.
Yes.
So tell us about
We count that
journey.
in dog years.
Do
so,
we?
Yes, it's a lot longer.
So tell us about your journey to how you led corporate comms for Cleveland Clinic.
Yeah, well, years ago I started out in healthcare and I really fell in love with healthcare because you're really touching patients' lives more than you know, even in a communications role, which has been a lot of fun. And you get very attached to the industry. And I think over time, I just had opportunity to get involved in different experiences at the Cleveland Clinic and really grew in my role and took on more challenges and then ended up being promoted to the executive director role. And I have a great team, so I don't take any of the credit for what I do. I give it all to them.
That's the sign of a good leader. Well, you want to take a seat in the over here on the side? And,
Sure.
Unless
hey, we're in good hands if anything goes wrong.
I know, right? Okay, so earlier this year, we published a study with Peppercom looking at how organizations are increasingly getting involved in social, cultural issues. So, for example, a company might take a stance on immigration or may take a stance on like an anti-transgender bathroom bill. Is Cleveland Clinic, what is sort of their philosophy with getting involved in sort of the social issues of the day?
Yeah, Cleveland Clinic is a very diverse organization. We employ people from all over the world. So we really, really are sensitive to, cultural issues that affect the world. At the same time, we try to stay as politically neutral as possible and really stay focused on our core mission, which is taking care of patients, researching their problems, and really educating future leaders and future physicians and other providers. We were thrusted into some political situations because one of our physicians was detained during the immigration ban. And so we were, not by choice, sort of thrown into the midst of it, trying to figure out, how do we advocate for an international audience of medical students and medical professionals that we really embrace here. So, we did get involved a little bit in trying to make sure that, number one, we could bring our physician back and really educate the elected officials about why having a diverse medical group is so important. The other issues would be the opioid crisis. Obviously in healthcare, that's a huge concern. And I think hospital systems and other healthcare providers are really looking at what's the best way to get involved and help to stop the crisis.
So how is Cleveland Clinic getting involved in that sort of issue?
Right now, we've done a lot of things internally. So we've changed our prescribing habits of our physicians, trying to look at alternative ways to treat pain and really look at a collaborative approach across Northeast Ohio and other communities that we serve to work together with law enforcement, mental health agencies, and others to really figure out what's the best way to prevent and treat patients that are affected by this.
So you're IPR trustee. You were also actively involved in AMEC, which is the Association for Measurement, Evaluation, and Communication. How do you take all these sort of research and measurement insights and then incorporate that with your team?
Yeah, I think it was about 8 years ago now where we started to really think about, we know PR gives a lot of value to the Cleveland Clinic, but we really wanted to understand how and why, and how do we become more strategic around our communication strategy. So research, analytics, measurements, all of those pieces, including just really trying to identify what is the Cleveland Clinic story and making sure we're telling a consistent story with consistent messages that we can measure, track, and then really, look at our strategy. So I think IPR and AMEC have really been great resources over the years to help us build our measurement and research program. So I think a lot of the insights from the research, a lot of the conferences where measurement is really, front and center, has become my obsession lately.
It's a good obsession.
It's a good obsession.
It's funny that we're still working on the whole measurement piece in
Yes.
our profession. It seems like it's been a 20, 30-year process.
Right. And anecdotally, we know when we have a great story on the news, the phone rings off the hook, but we can't really always tie it to patient revenue. And so that's really our focus is, what is our contribution to the bottom line of the organization? So it's a fun challenge, and I call it a journey, and we've been on a journey, and we'll probably stay on that journey for a long time.
A long journey.
Yeah.
Well, that's good. We're doing a program with KPMG, and we're looking at women in leadership and public relations, and it's a 2-part study. The first part, we did a series of 10 focus groups with men and women, in separate rooms.
Mm-hmm.
And then we have a second part of the study coming, which is the quantitative, the survey. So one of with the focus groups that we talked to senior level leaders and asked them about sort of mentorship, both informal and formal, sort of leadership skills, organizational policies, and how that may impact the growth and development. And we also asked them about sort of any barriers, because the research that we found is that while 75% of the profession is female, only 25% of leadership is. So do you have any thoughts about this or anything you want to contribute with that area and insight?
I think women who really can be confident, have good leadership skills, be good listeners, really be able to rally a team and make sure that you're supporting your team and getting the best out of them. And I think, we have worked really hard on building our reputation as communication professionals in the Cleveland Clinic. And that has really gone a long way to build our credibility. We're trusted. We're always at the table and helping a part of the decision-making process. So I think really just, good leadership skills are essential, and really being able to support really solid teamwork and get the best out of your group.
Yeah, and that's what with the focus groups said, both men and women, that it wasn't really assigned like the gender of the individual.
Mm-hmm.
It was more about possessing those exact qualities.
Right, and teamwork and hiring someone who's a good fit. Some people can look really good on a resume, but they might not be a good fit for the organization. We have a very clear culture at the Cleveland Clinic, and it's very innovative. It's fast-paced environment. It's, supporting each other, a culture of respect, and you need to have a team that really is behind that culture.
Okay, so now we're in the front of the mobile stroke unit, which is very spacious.
Yes.
This would be a great car. So let's talk about you. Yay. What is your career highlight?
My career highlight? Oh, wow, that's a big question.
Mm-hmm.
I've had really exciting first of its kind announcements that I don't think everybody gets to do that in their career. So for example, Cleveland Clinic did the first face transplant in the United States. And just being able to really be so proud of the organization and looking at the advancement of care for patients, and then having such a strong communication program to support all of those, wonderful medical achievements has been tremendous.
Oh, that's exciting.
It's one example of many, but I think I found my passion in healthcare. And really, like I said earlier, we touch the lives of patients as well. And it's just an honor and a privilege to really be a part of that, especially at an organization that does such tremendous work.
What's the best advice you've ever been given?
It's very short and simple. And it came from our board chairman, who said, "This too shall pass." And I think that's because in communications and in healthcare, it can be very stressful. We're dealing with life and death, and sometimes there's big crises like the Ebola scare, things like that. I think that, accomplishing and getting through some of those big challenges, our board chairman one time just said to me, "This too shall pass." And I kind of try to keep that in mind as sort of to keep you calm and keep you focused on what we need to do.
That's good to keep in mind, because sometimes when you're in it, you feel like it's really,
especially during a crisis,
right?
or sometimes it's a business crisis, or a lot of different things that are challenging. And healthcare is 24/7. We're on call. Healthcare doesn't stop at 5 o'clock or take off on the weekends. It's all the time. And so, I think getting through major challenges sometimes can really be a good reminder that, we'll get through it.
Right. So we have a future of work study coming out early next year where we interviewed people to find out what do they see that will impact the industry in the future, or even in the day-to-day. So it could be automation, or it could be how incorporating artificial intelligence, which I knew they're doing a lot with healthcare, and also just even with changes in the economy or political environment, or how people are demanding more. Right. Companies take a stance. So what do you see as sort of the future of work from an internal comms perspective, and what may change in the future?
Yeah, we're doing a lot of looking at, the generational differences between employees, so millennials versus others, and how do you best communicate to them? Because, in healthcare, you have a lot of nurses, for example, are walking the floors by the bedside of a patient. They're not sitting in front of a computer looking at the intranet. So we really have to find out what are the right tools to get the right message to the right employee through the right channels. And that's really a big effort underway right now at the Cleveland Clinic. So.
And you think that will continue, sort of the differentiation among the different generations?
Yeah, and I think technology is going to be a really important piece of that. I think upgrading, a lot of our, cell phones. A lot of people are mobile, and really, how do we best communicate to employees through mobile phones?
Okay, great. Well, I think we're going to go to your office.
Okay.
I hope.
Yeah, are we? It's very minimalist. Get ready.
That's good. That's good.
It's very clean.
All right. So in our final part of this,
You're not leaving. This is too much fun.
I know, it is a lot of fun. So I took this, and I know you probably saw it from another episode we did, but from Inside the Actor's Studio with James Lipton, how he would ask people a series of questions, and then they're fun questions. Nothing too difficult, I promise. And they're just a series of 10 questions just to know more about Eileen Sheil.
Okay.
So the first question, what is your favorite word?
Wow. Probably have many. Unpredictable.
Unpredictable. Why do you like that word?
I like surprises.
Do you? Surprise!
I do. I'm someone who really, I like change. I like constant movement. I like things to fall out of the sky. It's probably why I like to do crisis communication. But I like surprises.
That's very PR, right?
I guess.
Unpredictable.
Yeah,
you never know what's going to happen day to day.
But I'm comfortable in that kind of environment.
That's good.
And I have 2 teenage girls.
So how do you unwind and relax? Besides playing your Celtic flute and having your mistress.
You weren't supposed to tell me on that. Yoga in my office.
Just being around family and friends. And I think at the end of the day, I'm an extrovert. So that means at the end of the day, I don't wind down. I probably wind up more so than winding down. I don't sit still very easily. So I'm working on that. But I just, I just relax. I like to exercise, take walks, read, glass of wine occasionally.
Me too. All those things. So what profession other than this one would you like to attempt?
That's interesting because
I'm just thinking about that this morning. And I'm teaching a high school journalism class this summer. And I'm surprised how much I like teaching others about our profession. But I don't want to be a teacher. But I just thought it's kind of fun to share what you know with young, eager folks.
You could be a professor.
I don't know. It's fun to do it on the side.
as a side gig. What would you not want to do?
My brother's in finance, and I don't have that side of the brain. So
I wouldn't want to be a
So
banker.
numbers all day. And
No
all
numbers.
that.
So I'm not chairing the finance committee for IPR.
Okay, so last question. If heaven exists, what would you like God to say as you come to the pearly gates?
wow, these are tough.
They are tough.
These are really tough.
Yeah.
Welcome for a start.
You made it.
You passed. And that I tried to be a good person, and I always feel like treating others with respect and being kind to others, even especially in difficult situations, is so important, because the way you treat others is a reflection of who you are, and I try to treat others the way I want to be treated.
So I would
And
hope
he
you
will
would
acknowledge
say,
that.
come on in, or she.
That's good. Well, thank you, Eileen,
Thank
for
you.
having us today.
Thank you.
And this wraps up our episode of In a Car with IPR. Big thanks to our good friend Eileen Sheil, an IPR trustee who had us in Cleveland
Yeah,
with
welcome.
beautiful, beautiful weather.
Very nice.
So thank you,
snow.
Eileen.
Yeah, thank
There's
you.
no-
This was fun. Thanks so much.
So if you like this video, give it a thumbs up and subscribe to our channel so you can get more of In a Car with IPR.
Thank you for watching this episode of In a Car with IPR. Want to make a tax-deductible contribution to support this series and fund research in the profession? Please visit us at instituteforpr.org/contribute.